In this video, we will be going over what the Affordable Care Act means for the Young Invincibles. The Affordable Care Act, sometimes known as Obamacare, is a law that was enacted in March 2010 intended to reduce disparities so that all citizens can access health care without incurring significant debt. The ACA has 10 different sections, each one focusing on different aspects of healthcare, with the main emphasis on including improving quality and lowering costs, increasing access, and protecting consumers. It also includes a section on how the government is going to pay for all of these changes. These are the 10 sections of the Affordable Care Act. Title 1. Quality, affordable health care for all Americans. Title 2. The role of public programs. Title 3. Improving the quality and efficiency of health care. Title 4. Prevention of chronic disease and improving public health. Title 5. Healthcare workforce. Title 6. Transparency and program integrity. Title 7. Improving access to innovative medical therapies. Title 8. Community Living Assistance Services and Supports Act. Title 9. Revenue Provisions. Title 10. Reauthorization of the Indian Healthcare Improvement Act. This law affects everyone in the United States, from the elderly to newborns. We will be focusing on one group commonly called the Young Invincibles. These are young adults between the ages of 18 and 34. The government estimates this group composes 42% of the uninsured in Oregon, which is nearly 217,000 young people. One of the most important parts of the Affordable Care Act, the ACA, is that it requires every citizen to be covered by a health insurance plan. Today, options for coverage include insurance through your employer, through a government program such as Medicaid or Medicare, or by purchasing individual coverage through a private health insurance company. If you do not get any kind of coverage, you may have to pay a fine, but it's not just about penalties. There are positive reasons to get insured too. Private plans are available to citizens through the ACA's Insurance Marketplace, which is a website that shows what plans are available to you. In order to be included, these plans are required to cover 10 essential health benefits. Among these essential health benefits are preventative services, maternity and newborn care, pediatric services, mental health services, prescription drugs, and emergency services. Did we mention prevention? There is a huge emphasis on the importance of preventative care in the ACA. Preventing disease and illness reduces costs in the long run and is particularly important for the Young Invincibles to stay invincible. Sounds good so far, right? But how does this insurance thing work? Many young people have never had to understand how insurance works because their parents take care of it for them. At first, it can be really confusing and overwhelming to figure out what all the terms mean, which might make you want to give up and go without coverage. Luckily, the ACA requires insurance companies to provide you with an easy-to-understand summary about a health plan's benefits and coverage, using standardized terms in plain language. Unfortunately, plain language is still often not clear, so here's a quick rundown of some common health insurance terms. When you get a health insurance plan, you have to pay a monthly premium to keep the plan, just like you have to pay your utility bill each month to keep the lights on. In exchange for your premium payments, the insurance company agrees to pay a certain amount for your care. If they don't cover 100%, the rest has to come out of your pocket. This is called coinsurance, or sometimes a copay. However, if you keep getting sick, your bill won't keep going up indefinitely, because each plan also has what's called a deductible. Once you have paid your portion of the medical bills up to the deductible, the insurance company will cover the rest. Generally, the more you pay for your plan, the lower the deductible will be. Super high deductible plans are called catastrophic plans because you pay for everything out of pocket unless something catastrophic happens, at which point the insurance company will cover your now huge medical bills. These plans are only available to people under 30 years of age. So how do you know what your plan will cover or won't cover? Before you buy a plan, the insurance company will provide you with this information. Plans offered on the Health Insurance Marketplace, which we talked about earlier, lists all of this information on the website. If you're still confused, your parents might still be able to help. One of the first changes the Affordable Care Act put into action is that children could stay insured under their parents' health insurance plan until the age of 26. The government estimates that 3.1 million young people between the ages of 18 and 25 gained insurance coverage between when the law was enacted and December 2011 due to this change. This is great for those of us who are under 26 and have parents with a family insurance plan. What about the rest of us? The ACA mandates that employers with more than 50 full-time employees will now be required to provide health insurance. If you work for a large company, you might be able to get coverage there. Unfortunately, there are a variety of loopholes in this rule. Sources such as the Congressional Budget Office suggest that by 2018, as many as 7 million people could be dropped from their employer's plan due to these loopholes. So for young invincibles just now entering the job market, the lower paying, often part-time jobs you can expect to get may still not include health insurance. If you are in this situation, don't despair. As we said before, you can buy an individual plan through the marketplace. You may even be eligible for tax credits to help you pay the monthly premium of the insurance plan you choose. If your monthly premium is still too expensive after the tax credit, meaning it costs more than 8% of your income, you will not have to pay a fine for being uninsured like everyone else does. By now you might be saying, but I'm not going to get sick, I'm invincible, and besides, the government can't tell me what to do. Well, actually it can. The Supreme Court upheld the law in a ruling on June 28, 2012, saying that it is in fact constitutional to require individuals to get health insurance coverage. So join the masses and sign up. What are some of the other reasons we young invincibles should sign up, even if we don't think we'll need to use the health insurance? One important thing to consider is that if we, the young invincibles, don't put money into the pool, others won't be able to benefit from the new system. Our premiums help pay for the care of everyone else on the same insurance. When we are old and sick, the next generation of young invincibles will be paying for our care. It's kind of similar to Social Security in that way. The government has estimated that the new healthcare system will go under without young invincibles, making up 40% of those insured through the marketplace. You also never know when you might get sick. Paying little by little every month could save you a lot of money in the long run if something bad happens and you end up in the emergency room. Most importantly, having health insurance offers you peace of mind. For a reasonable copay, you will be able to visit a doctor whenever it may be necessary. This way, you can be an informed agent of your own health and well-being. The ACA is not perfect, and in fact, there are still a lot of questions about how it will all work, where the money will come from, and if it will even fix our healthcare system. The good news is that if young people like you stay informed and politically active, there is a good chance that together we can fix these problems and make sure that everyone can stay healthy and get the care they need. Get covered. For more information, visit healthcare.gov or younginvincibles.org. Thanks for listening.